Okay, so thank you for having me here. My talk is about colorectal cancer screening. And as you know, colorectal cancer is the second most common cancer in the population, the third most common cancer in men, and the second one in women. It has like over 1 million new cases every year, and it has quite a high mortality rate, which is why a lot of countries have by now established public screening programs to decrease mortality. But still too few people get screened for colorectal cancer, and this is actually a shame because early detection can lead to very good prognosis, because colorectal cancer is a highly treatable disease, and we see a survival rate of over 85% when CRC is detected in an early stage of the disease. The primary screening methods for the detection of colorectal cancer are, as a gold standard, the screening colonoscopy, which comes with a lot of discomfort for the patients. It's quite an invasive procedure for a healthy individual to undertake. It requires bowel preparation, sedation, comes with a lot of pain, and so far the only non-invasive alternative you have is fecal testing, whereas a lot of people don't really feel comfortable with handling their own stool. So what we do, we want to provide a new alternative for colorectal cancer screening in a blood-based test that we offer. And this test uses the septin-9 biomarker to detect colorectal cancer. And the idea is that it's very convenient for the patient because he only gives a simple blood draw, and then you can give your blood to a molecular lab, and who can run the epiprocolon test. That is a real-time PCR-based assay for the detection of methylated septin-9. And only in the event of a positive test result, you refer your patient to a diagnostic colonoscopy. The technology behind the detection of the methylation biomarkers is the bisulfite treatment, because bisulfite treatment usually converts DNA, but if the DNA is methylated, it would not be convertible, and therefore can be detected in a PCR assay. And DNA methylation in general is a hallmark for a lot of cancers. There are a lot of methylation biomarkers, and the septin-9 is quite specific in association with colorectal cancer. So the test is based on plasma as a sample, so this is all in the field of liquid biopsy. And after DNA extraction, you would perform the bisulfite conversion, and then you run a real-time PCR, and the whole procedure altogether takes around 8 hours, including the PCR run. And from a clinical performance point of view, the test shows really good results in sensitivity with 81% of possibility of cancer detection, and has a specificity between 97 and 99%. And when you compare this to other non-invasive tests like the FOB test or the FIT test, which more or less all rank in the same area of specificity, we are able to outrank them in the sense of sensitivity. So it's highly detectable for colorectal cancer. Since we aim to increase participation rate in colorectal cancer screening, there was an adherence study performed from Dr. Adler at Charité Berlin, and what he did is he picked 172 eligible individuals for screening, and they were all offered the gold standard, the screening colonoscopy. And only 37% of them agreed to undergoing the colonoscopy, whereas 63% of them said, no, we don't want to do that. It's too much of an invasive procedure for us. So these patients were offered a non-invasive test, and they had the choice between a stool test and a blood test. And it was actually 83% of the participants who decided to take the blood test, whereas only 50% took the stool test. And by this result, the the additional offering of an additional option of a blood testing was able to increase the participation rate to 98%, which shows the clinical need for offering more options to the patients in order to get them to get involved into colorectal cancer screening. And this is basically the take-home message from this talk, is the success of a screening program is not only depending on the clinical performance of the tests that you're offering, but is also depending on the willingness of the target population to participate. And the best way to achieve that is to give them more options and choices. Thank you.